Short answer to this question is yes. Now, I'm not a huge fan of the term estrogen dominance for several reasons. Also, because it's not a term that we typically use in medicine, but I know exactly what you're talking about. So, usually, this term is referring to premenopausal people with ovaries who are not having regular periods and who are not on any sort of hormonal or hormonal manipulating medications. If you're not having regular periods, that usually means you're not ovulating regularly. And it's the process of ovulation that makes the ovaries produce progesterone in the second half of our menstrual cycle. So if someone is not ovulating and not having periods, that means that their ovaries are not producing progesterone and only producing estrogen. Combined contraceptive pill is a birth control pill that has both estrogen and progestin. And regardless of why you're taking the birth control pill, whether it's to control acne or periods or for birth control, if you are someone who is skipping periods because you're not ovulating, so you're not producing that progesterone, it is okay to take a combined oral contraceptive pill. This is because the way the combined pills work is they work to suppress the function of the ovaries, so the ovaries are not creating their natural level of natural estrogen, and it's the pill that's taking over that supplementation for your body, and therefore it's the pill that's giving you the amounts of estrogen and progestin that you need. Progesterones are important for the body for a couple different reasons, but for people who are not making natural progesterone and who are only producing estrogen, we know that estrogen stimulates the lining of the uterus or the endometrium, and progesterone is the hormone that usually balances that stimulation or prevents kind of that overstimulation of the uterine lining. Because chronically over many, many years, if you have a lot of estrogen that continues to stimulate the lining of the uterus or the endometrium, it could put you at risk for precancerous or cancerous changes of the uterus. It's the progesterone produced by the ovaries that prevents this and keeps that lining organized. When you are not producing that progesterone on your own, sometimes it is really important to give that progesterone, and often that is in the form of either combined oral contraceptive or even a progesterone only method. It's a lot of information, but I hope it answers your question.